Many of you might have heard of US administration's decision to approve Biogen's Alzheimer's drug, Aduhelm. Some of you might be aware of the controversy around it. In this video, I'm going to talk about the background of what this drug may or may not do, the mechanisms behind Alzheimer's dementia, and what is some of the controversy. So let's get started. It all began with the publication of this initial study on the antibody aducanumab in 2016, where its use was shown to reduce amyloid beta plaques in Alzheimer's disease. I'll explain these amyloid beta plaques more in a minute, but for the moment, suffice to say that these are one of the earliest hallmarks of Alzheimer's dementia. The drug works by attacking these clumps of amyloid beta, removing them over time. This early study showed that relative to no treatment, the use of antibody aducanumab resulted in reduction of amyloid beta plaques in Alzheimer's disease. The study also showed that higher doses of the drug removed the plaques more effectively, even resulting in some benefit in cognition, such as improvement in memory, orientation, and problem solving. That sounds great. So what is the controversy about? Well, Biogen subsequently undertook two phase 3 efficacy trials called Emerge and Engage, and their results were less than overwhelming. Emerge was initially discontinued for not meeting endpoint, but reanalysis showed that relative to placebo, Aduhelm helped improve cognition and function. Engage, however, did not meet its primary goal, but some data suggested to benefit those who received high doses. The FDA approval, despite these mixed findings for these trials, has confused many neurologists, even resulting in 3 members of the advisory panel resigning. So if the drug is effective in removing amyloid plaques, why was it not found effective in these studies? To understand that, you will have to go back to the etiology or the background processes behind Alzheimer's dementia. The most well-accepted explanation for how Alzheimer's disease progresses is what is known as the cascade hypothesis, which has a lot of supporting evidence. In cascade hypothesis, it all starts with the formation of amyloid plaques, which are really misfolded proteins. Over time, these plaques result in formation of neurofibrillary tangles or tau tangles, which then lead to neuronal death or neurodegeneration, impairing cognition, memory, and language. These steps can be summarized as amyloid, tau, neurodegeneration, or ATN steps. In simple terms, the cascade hypothesis describes Alzheimer's to develop in a sequence of A, T, N. Therapy with Aduhelm following the cascade hypothesis selectively targets amyloid plaques only, hoping that timely removal of amyloid plaques would stop resulting formation of tau tangles and neurodegeneration. However, as more evidence accumulates, researchers have found that this is not the only mechanism behind Alzheimer's dementia. Researchers have found evidence for a tau-first Alzheimer's dementia and a type where A and T accumulate in synergy. Thus, there is no guarantee that tau tangles haven't already started forming when Aduhelm starts acting to remove amyloid plaques. This is also why most neurologists and researchers feel that any drug targeting Alzheimer's dementia should seek to remove amyloid plaques and tau tangles at the same time. That is why the drug is more likely to affect only in the very early stages of AD. Moreover, Aduhelm also resulted in significant side effects in the form of amyloid-related imaging abnormalities, or ARIA, which is a form of swelling and bleeding in brain that often gets better on its own. All in all, most clinicians I spoke to are skeptical of the drug, are confused by the FDA approval, but some may use it in very early phases of AD. If you were hoping that Aduhelm will be a miracle drug for a 94-year-old with 10 years history of Alzheimer's disease, you may be disappointed. But the drug may open doors for future FDA approvals and further research into predicting its effectiveness.